Hello there. How are you today? Good. Well, I am Dr. G, and I will be taking care of your MRI today. So I have your medical chart right here, and I can see that we're doing the MRI today because of some very, very persistent headaches that you've been having. Yeah, this should be able to get to the bottom of it. But before I can take you to the MRI machine and then begin the testing, I actually have to go through a questionnaire with you. This is just a standard MRI questionnaire, nothing too complicated. I will be needing you to sign off on it before we can take you. And I'll also need to confirm some information with you, and as well as take your heart rate and your pressure. Just very simple things, just to make sure that in this very moment you are in good enough health for us to conduct the MRI. Sounds good? Okay, good. Well then, I think that I will go ahead and begin by taking your heart rate. Let me put on some fresh pair of gloves right here. These gloves are a little bit stubborn to put on. There we go. Okay, and just to warn you, this is going to be a little bit cold. I'm just going to need you to pull your shirt a little bit to the side just so that I can put this on your chest. Okay? Good. Now, if you could take a deep breath for me. Hold it. Okay, good. And now exhale. Good job. Okay, once again, take a deep breath for me. Hold it and exhale. Okay, good. And now I'm going to repeat it on your back. Okay, I'm just going to be lifting your shirt a little bit so that I can place it there. I'll be asking you again to breathe in, hold, and exhale, okay? So just on my instructions. Okay. Okay. There we go. If you could inhale for me, hold, exhale. Good job. Okay, again. Inhale, hold, exhale. Okay, good. Okay, thank you so much. So now I will be taking your pressure very quickly. If you could just put your arm out in front of you for me. Okay, good job. Thank you. I'm just gonna have to get a little bit closer. Okay. Okay, that's okay. Good. Okay, let's give it a moment. Okay, good. Okay, great. So now we will be proceeding to the MRI questionnaire. All right? Okay. Okay, so if you could begin by confirming your first name and last name for me. Okay, good. Date of birth. Okay, good. Approximately, what is your height? Okay. And approximately, what is your weight? Okay. Okay, so this is the MRI Safety Screening Questionnaire. This is the standard for any patient undergoing an MRI. So I'm just going to be reading this out to you, and then there will just be some yes or no questions. Answer them as honestly as you can. All of these are very vital to the MRI testing. Okay? Okay. So the following items may be harmful to you during your MRI scan and may interfere with the MRI examination. Please provide a yes or a no for every single item. Okay? Okay, so a cardiac pacemaker or implanted cardioverter defibrillator. Okay, so no. Internal electrodes or wires. Okay. Artificial heart valve, coil, filter, and or stent. No. Good. Aneurysm clip or clips. Okay. Neurostimulator or TENS unit, biostimulator, bone growth stimulator, DBS or VNS. Okay. No. Any implanted drug pump for chemotherapy or pain medicine. Okay. So no to that as well. A IV access port, Portacath, Broviac, PICC line, Swan Gantz, thermodilation. Okay, any IV access ports? No? Okay, good. Do you have an external drug pump for insulin or other medicine? No? Okay. Any implanted port surgical hardware, pins, rods, screws, plates, or wires? Okay. Artificial joint or limb? No, good. Artificial eye and or eyelid spring? Okay, so no. Eye injury from a metal object, metal shavings, or metal silvers? Okay. Good. Do you have a cochlear ear implant or a middle ear implant? No. Any hearing aids? False teeth, dentures, metallic removal dental wear such as braces or retainers? No. Any type of implant held in place by a magnet? No. Have you ever been injured by any metal objects such as shrapnel, bullet, BB that required medical attention? No. Okay. Any medication patch such as nicotine, contraceptive, or estrogen? No. Okay. Do you have a shunt or a SOFI adjustable and programmable pressure valve? No. Okay. Spinal fixation device, spinal fusion, and or halo vest spinal cord simulator. No to that as well. Surgical clips, staples, or surgical mesh. No. Good. Tissue expander. No. Do you have an IUD or a diaphragm? No. Penile implant? No. Radiation seeds, such as for cancer treatment? No. Okay. body piercings, tattoos, or permanent makeup? No. Okay. Wig or hair implants? No. Okay. Good. So now I will be asking a little bit of your history. Once again, just answer with a simple yes or no. Okay? Okay, good. Do you have a history of kidney disease? No. Okay. Diabetes? No. Liver disease? No. Have you ever experienced claustrophobia? No. Okay. To your knowledge, are you allergic to any drugs? Not that you know of. Okay. Good. Do you have a latex allergy? No. And to the best of your knowledge, do you know if you're allergic to the MRI contrast agent known as gadolinium? So not that you know of. Okay. Are you on dialysis? No. Okay. Okay, perfect. So that was it for the questionnaire. I will let you know that we have your gown and we also have some slippers that we have provided, and I've left them for you on that chair. So once I leave the room, you can just get dressed. I'll come back in and I'll escort you to the MRI machine. Okay, and we also will be providing you with a locker in case you want to keep your valuables in there, and you will be receiving a key for that. Okay, and just to kind of further, I guess, with the questionnaire, no jewelry, no body piercings, no metal whatsoever is allowed in the machine. So if you have any earrings, any jewelry, right now is the time to take them off. Did you have anything like that? Okay, so none of that. Okay, good. Okay, I will be providing you with a pair of headphones. We also provide earplugs, but our MRI machine does have a screen kind of to create a duo connection where I'll be giving you some instructions, and you'll also be able to hear me and see me through the screen. Okay, yeah, it'll make it a little bit less stress-inducing, hopefully. Some people seem to get very anxious with the very loud sounds that are produced by an MRI machine. Yeah, it can be quite bumpy sounding almost, but with the headphones or with earplugs it is very manageable. Some people even find it relaxing. I'm one of those weird people. Yeah. So in any case, we have everything good to go for you. I will be requiring just a quick signature from you right now, just before I can take you in, and then everything is good to go. Okay? Okay, so let me just hand this over to you, and then I'll give you the pen. Okay, here you go. Okay, good. Perfect. Okay, wonderful. So then I'll leave the room so that you can get changed, and then I will take you over to the MRI machine, get you set up. Okay? Okay, great. Okay. Are you nice and comfy in there? You are? Okay, that's good. Yeah, the mattress tends to be a little bit comfortable just because you're going to be in there for a good bit. These MRIs take a little bit of time just so that we can get all of the images of your brain. I'll be needing you to stand, or not stand, lay very, very still for me from head to toe. So don't move so that we don't have to retake the pictures and then it'll take even longer. So you have your headphones already. Okay, good. So once I roll you in there, you'll see a screen turn on above you, and that'll be me inside of the booth. I'll be giving you instructions, so just follow to the best of your ability. Okay, great. Okay, awesome. Well then, see you then. Can you hear me all right? You can. Okay, good. Can you see me on the screen? You can. Okay, wonderful. So I'm going to be over here in the booth, directing you as best as I can. There's not really going to be much for you to do in there, but the most important thing is that I need you to stay as still as you possibly can for me. There's going to be 5 cycles of images, and we'll be taking pictures from different angles of your brain. So I need you to stay as still as possible. If you mess up, it's okay, but it just means we're going to have to run for a little longer, okay? So just try your best to not move. Remember to, take deep breaths, breathe in, breathe out. Okay, good. And like I said, just because it's the brain, we still need you to stay still from head to toe. Okay, great. So you're going to hear, of course, the very loud sounds coming from the MRI. I'll also be typing on my end. I have the screen right in front of me, and I'm watching the progress of your photos as they develop. Just making sure that they are clear so that we don't have to redo a cycle. Okay, good. You're doing great in there. Just try to stay as relaxed as you can. I know it can get a little bit stressful in there. Okay, if it becomes a little overwhelming, don't hesitate to let me know, okay? I can hear you over the mic, so we have this connection, okay? Okay, good. Okay, so we are initiating cycle 1, photos, and so far they are rendering nice and clear, so you're doing a good job of staying still. You're doing great. How are you feeling in there? Okay, still good. Okay, if it gets a little bit unpleasant, just let me know. We actually have a visual calming playlist that I can actually play on the screen for you. They're just nice, calm pictures that kind of trigger your happy place. Did you want to try that? Okay, so not just yet. Okay, we'll hold that. And the pictures are rendering quite nicely. You're doing a good job of staying still. Okay, I'm actually going to ask you to take a deep breath for me right now. Just inhale, hold, exhale. Okay, good, perfect. You're doing a really good job. Yeah. Some people get stressed in there, but it can be a little bit calming if you just let the noises kind of just drift you away into a calm. Sometimes, honestly, some people sleep in there sometimes, so if you fall asleep, it's okay. Yeah, even with those sounds being so loud, they're kind of a little monotone, so just the same thing sometimes lulls you to sleep. Okay, cycle 2. nice that we implemented the camera. We used to not have the screen, and people would try to look up at the booth, and we'd have to retake pictures over and over again. So the screen helps kind of create more of a calming feeling for you when you're inside of the machine. And it's also nice to have that two-way communication just in case anything goes out of the ordinary, out of what we expect. Sometimes people panic in there, but with the screen, you know that you're not alone in there, and that I can hear you, and you can see me. So yeah, you're doing all right. Okay, good. Just stay still. Keep breathing in, hold, and out. You're doing really good. Still doing okay in there? Good, good. Yeah, I just like to keep checking up on you. Okay, I'm glad that you're doing okay in there. Are the sounds bothering you too much? No? Okay, that's good. The images are coming out nice and clear, so you're doing a great job at staying still. Yep, just keep it up. I'm going to ask you to, once again, take a deep breath for me. Hold and exhale. Okay, good, thank you. Okay, so we're just about to finish cycle 3 and enter cycle 4 set of images. So you're doing really good. So far all the pictures have been coming out nice and clear. Yeah, that way this isn't going to take any longer than it has to be. Okay, you're doing great. Good job. want to begin the comforting playlist yet? In a little bit? Okay. Yeah, it's just a series of little nice images that stimulate the mind, kind of distract you from being in that machine. Yeah, it's quite nice. Oh, did I pick out the pictures? No, it was actually somebody else, but I've seen it many times, and it's a pretty good playlist. There's some nice calming pictures in there. So we are now initiating cycle 5, so we're getting a lot closer to finishing. This is the cycle that takes the longest though, so did you want to start that playlist? Okay, great. So I'll be initiating it in a moment, and you can just let yourself drift away into deep thought. Just keep doing your breathing. And I'll still be able to see you on the computer, so just do your best to keep staying still so that we can finish this off properly. Okay, good job. Yeah. Okay, so I will be initiating that playlist. So I'll be turning that on so you won't be seeing me anymore. But if you need anything, just speak into your mic and I'll be able to hear you, okay? Yeah, I'll just be monitoring the pictures. It seems like we're finishing up really well. All of the pictures have come out nice and clear. The doctor and the neurologist are going to be quite pleased with this, so that they can begin the analysis, and we should get to the bottom of those headaches, okay? Okay, good. So I'll be initiating it in a moment.